Starting from the end of this month, South Korea will lower the infectious level of COVID to the lowest group 4, treating it in the same way as seasonal influenza. The authorities will no longer count daily figures and reduce related financial support. Our Choi Soo-hyung tells us more.
Starting from August 31st, the South Korean government will lower COVID-19's infectious disease level from Group 2 to Group 4. The Korea Disease Control and Prevention Agency said on Wednesday that this decision was made due to a decrease in the spread of COVID-19 since the end of June, a reduction in virus risk, overall stable epidemic prevention conditions, and sufficient capacity within the general healthcare system.
The government made the decision to classify COVID-19 as a Group 4 infectious disease by examining those circumstances, and it plans to implement the second stage of measures according to the COVID-19 roadmap announced in March.
Furthermore, the agency stated that although 1 or 2 major and minor COVID-19 outbreaks are expected each year, most countries worldwide have already been managing COVID-19 within their general medical systems. The decision means the focus now will shift from counting daily case numbers to protecting high-risk groups. The downgrade from Group 2 to Group 4 means there will be no more daily reporting of confirmed case numbers, which had been going on for 3 years and 7 months. Also, under Group 4, people no longer need to report COVID-19 infections within 24 hours, nor do they need to isolate. Instead, the government plans to operate a more precise monitoring system to observe the COVID-19 trend on a weekly basis. However, the officials said that even with the transition to Group 4, there are still ongoing concerns about new COVID-19 variants.
The greater the number of transmission, the greater the chances of occurrences of yet another new variant. In that regard, we should also keep a close eye on what can come from purely just this high numbers of daily new cases, not just within our nation, but in other countries as well.
The KDCA said that masks will still be required for the time being at infection-vulnerable facilities such as hospitals and nursing homes. Additionally, support for COVID-19 diagnosis and treatment costs, operation of screening clinics, and the supply of vaccines and treatments will still be provided free of charge for now. The government stated that it will manage the epidemic situation in a stable manner going forward. Choi Soo-hyung, Arirang News.